Welcome, everyone. This is the Alliance of Nurses for Healthy Environments Introduction to the Justice, Equity, Diversity, and Inclusion Committee. I'm Hannah Knoll, and I am the Director of Member Engagement and Professional Education here at the Alliance of Nurses for Healthy Environments, or ANHE. And I will let my colleague and chair of the JEDI Committee introduce herself.
Good afternoon, everyone. My name is Jessica Verghese. I am the chair of the JEDI Committee here at ANHE, and I work full-time as an assistant professor of nursing at New York Institute of Technology in Old Westbury, New York.
Okay. Next slide. If everyone could share in the chat your name, where your title, and where you're geographically located, that would be wonderful. Next slide. Oh, not next slide, just kidding. And so just to get started, obviously, we are the Alliance of Nurses for Healthy Environments. Most of you have been with us in some capacity. If not, welcome. We are the only national nursing organization focused solely on the intersection of the environment and health. Our mission is promoting healthy people and healthy environments by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policy. We hope to engage nurses and prepare nurses to assure the environmental health and the overall health of all people, to overcome environmental health disparities, and to heal our communities and the earth for present and future generations. So starting with the definition, so we have some shared language. Why justice? Why include justice and not simply diversity, equity, and inclusion? The definition of justice is the condition of being morally correct or fair. And here at ANHE, a place where we want all who join, whether it's just for one call a year or for every event we host, we want everyone to feel welcome, valued, and included. And especially in light of recent events and administrative changes, we not only want justice, equity, diversity, and inclusion to be infused throughout every corner of the organization, we also want this to be a place where people can work together to brainstorm ideas, to celebrate, and to create actionable plans that further justice, not only here at ANHE, but also in the communities where they live and work as well. Next slide. This is ANHE's commitment to justice, equity, diversity, and inclusion. We would like to intentionally integrate principles of justice, equity, diversity, and inclusion throughout our programs and initiatives and in our health, environmental, and community-based partnerships and collaborations to increase diversity of composition in our organizational leadership, staff, committees, and membership, to place justice, equity, diversity, and inclusion at the forefront of organizational and programmatic decision-making to drive meaningful and sustainable change. We want to deliberately seek guidance and feedback from EJ leader allies, both those that we are already working with, and also to foster new relationships so that we continue to learn in this process and truly work towards justice, equity, diversity, and inclusion. And lastly, to have demonstrable outcomes of greater equity, diversity, and inclusion within the organization, and again, in the communities where you all live and work. So as an organization, we believe in this, and so we've created a committee to help us meet these goals and grow in this area. We created this committee to help ANHE continuously live up to our JEDI commitments. It's one thing to verbally commit to something, and it's another thing to live up to those commitments. We understand that we're going to need help in doing so. We also created it to be accountable to our members. We also understand that we won't always get it right. It's common for organizations to be too busy to incorporate Jedi, but that's not the future that we want here at ANHE. We want to keep our commitment a priority, and we believe that this committee will help us to do so. Third, we want to create and support organization-wide practices that will infuse our Jedi principles into everything we do. We're looking for guidance and support from this committee that will put us on a path of ensuring that our Jedi commitments are a part of everything that we do. And fourth, we want to ensure that we have diverse perspectives and input on how we as an organization can do all of this effectively. We won't be effective in integrating Jedi if we don't have as diverse a range of people and input that we support and we take care of in our lives. And we don't want to leave anyone or any groups out. And I am going to pass it to Jessica.
Fabulous. So the Jedi Committee was initially formed in 2020 with the goal of really identifying how we can move into really understanding how is ANHE committed to these Jedi, to the focus of Jedi. We started with a survey just to see what the baseline scope of our layout is with our members. In addition, over the past year, leadership in the Jedi Committee had actually gone to a lot of the committee forums and groups to talk about how each organizational group, whether it was the research or policy or climate change, how each organizational group could kind of work towards these goals. So we call them road shows, but we wanted the committees and the forums to really hear what our thoughts were, but also in addition to that was to hear what people thought and what our membership really was looking for. So as a committee member, we usually meet once a month. And one of our goals is to really create and share recommendations with ANHE to increase member representation, as well as get more nurses involved in the work that ANHE is doing, right? We want to provide input to ANHE forums, committees, and staff on their Jedi goals. So we're practicing both internally and externally what we preach as an organization. We want to increase access to growth opportunities for members, including committee members. So looking for educational opportunities that members want, growing our advocacy, empowering nurses from all backgrounds to be part of this pivotal change work for healthier environments and healthier communities. So this is an example of the kind of thing the committee will be creating, right? So looking to see if our meetings are creating a sense of community and relationship building. Are there voices that are missing when we're having our meetings? Is there a formalized relationship or process to reaching out to unrepresented team members who cannot attend meetings? So these are a few examples of different things that we are looking for, but we want people to be part of the conversation about what actions ANHE can take to be better, right? So the role of the Jedi Committee is not to represent the organization, but to act as a working group to infuse Jedi throughout the organization and its members. So, we've sort of given you a lot to think about, but we really want people to know that this committee isn't to check a box, but to really build on ANHE's Jedi commitments throughout the organization. As chair, I have a few thoughts of what things I'd like to see, but really emphasizing how to train new leaders that represent the diversity of nurses to lead both in the organization and outside of the organization. We've discussed creating a contact list of nurse leaders who are experts that we can tap to present, to lead webinars, or be speakers at events that ANHE is asked to show up to. We want to continue to build relationships with with other nursing associations to be able to connect with a more diverse set of nurses. And even to create a ANHE Jedi guidance document to really emphasize where we are and what we'd like to do. So at this point, we'd really like to hear what you all are thinking, and what your thoughts are in terms of what you'd like us to focus on.
And before I stop the recording, I just want to let everyone know that, especially those who are watching this after the meeting, you can also provide this feedback and have discussions by emailing jedi@envirn.org. So I'll stop the recording now so we can have a conversation here today.